Welcome back. 9 students at a Chula Vista charter school have contracted chickenpox, and only one of them was vaccinated, which tells you something. Signs of the highly contagious disease began showing over the past month at the Deheza Charter School. Chickenpox is easily spread by coughing and sneezing. 25 cases have now been reported in San Diego County so far this year. Joining us to talk about these recent outbreaks is Dr. Jamie Friedman. She is with the Children's Primary Care Medical Group 4S Ranch, which is affiliated with Rady Children's Hospital. Good morning to you.
Good morning.
It doesn't surprise you, I suppose, when I tell you that all but one of the cases, the kids weren't vaccinated.
Right, that's right. Chickenpox vaccine, when you have two, the series of two, so the first one's at 12 months, the second one is at age 5 or kindergarten, is about 90% plus effective at preventing chickenpox. So it is not surprising that if there's a chickenpox outbreak, that there were some people that were partially or not immunized at all.
Talk about how serious this disease is, because a lot of people know what chickenpox is because before the vaccination, you probably got it as a child and then it went away, but not always the case. It can be pretty darn serious.
Right. I had it. It wasn't very fun, but I survived, but plenty of people didn't. There are a lot of complications of chickenpox. First of all, you have a very uncomfortable itchy rash on your whole body, which can lead to open sores, which can lead to infection, and that infection can go to the bloodstream. You can also get pneumonia, encephalitis, which is inflammation in the brain. So prior to the vaccine, thousands of kids were hospitalized with chickenpox every year, and about 100 to 150 kids in the United States would die of chickenpox every year.
That doesn't happen as much now, but when you hear about these type of cases, when the majority of kids aren't getting vaccinated at one particular school, you got to wonder if that's the case everywhere.
Right. So what happens is part of vaccination, because nothing is 100%, is also your herd immunity. So your herd immunity is like your brick wall around your community. So when some people aren't vaccinated, it's like taking the bricks out of the wall, and then the virus gets in. So those few kids who are vaccinated and did get disease, very, very mild disease, you're not going to see those complications, the hospitalizations, the death from it. So it's definitely milder, still very much worth giving the vaccine. But you have to also think about, are your neighbors, are your kids' friends vaccinated, because they can still affect your kid, even if your kid had their shots.
How contagious is this? It spreads pretty darn easily, doesn't it?
It does spread very easily. The infectious diseases spread, the contagiousness varies. So some are really hard to get. Some, like measles, you can stand in an elevator and get it if someone was there 2 hours ago. Chickenpox spreads easily because it spreads from the open sores, but it also spreads from your respiratory droplets. So you breathe, you cough, you sneeze, like you had said before. If it gets on a surface, a kid touches it, touches their mouth, then they can get it.
Is it true that you only get it once in life?
Usually, but the virus itself lives in your body. It lives on your nerve cells, and so it can be reactivated, what's called shingles. So adults can get shingles from having had chickenpox in the past. So it always stays in your body, but usually you have lifelong immunity. Now, I'll give you a quick caveat on that, because I had my immunity tested about 40 years after disease, and it was negative, so I had to get revaccinated.
Oh, really? Okay, maybe I should check that myself.
You should get it checked.
As a doctor, how do you treat chickenpox once a child or an adult gets? Is it more serious for an adult if they get it, or less serious?
It's more serious for an adult to get it, but and infants, and pregnant women too. Very serious for pregnant women.
How do you treat it?
Well, you can use medications, and most people who have a normal immune system, pretty healthy, you don't have to use the medication. Just comfort care, treating the fever, treating the itching, making sure that you don't have open infected sores. But there is medication that can help mitigate the disease. It doesn't make it go away, though. You can still get shingles in the future if you take the medication.
Once there is an outbreak, say at a school like this, what should be done? I mean, you send your kid to school, you have a very good chance that they're going to get it. This is as late as the latest case was reported April 25th, and they say it takes 2 weeks for symptoms to appear. Right.
My understanding is you have up to about 21 days that you can see symptoms. So kids who are not vaccinated, who are out of school, I think they have to be out for maybe a total of 3 weeks. Once you're in that 3-week, 4-week mark and you're not seeing symptoms, you're probably in the clear.
Yeah, okay. You said that you get those vaccinations very early on in life. What, 18 months or?
12 months, and 5 years.
And 5 years. Okay, if you haven't done that and your child is in elementary school or grade school, what do you do now?
Get it done.
And you spread it out the same distances?
No, you don't have to. Once you get the first one, the second one can be 3 months after. But it is a lot better to get the total series because your protection is a lot better. And so some schools where they only require 1 shot, you're going to have some of these problems where some of these kids get infected because their immunity is not as good.
If they get the vaccination, what should parents expect? Are the kids going to get a little bit ill with the vaccination? Or
well, when you get a shot, it triggers your immune system to make immune cells, just like when you get sick with with a virus. It's not any different. So when your immune system is activated, you feel a little under the weather, maybe a fever.
Yeah.
Most kids feel nothing. But if, I tell parents, if they get a little fever, they feel a little under the weather, that's a good sign because that means their immune system's working and they're making immune cells to protect their child.
Sure beats being fearful of an outbreak, right?
And having head-to-body sores.
Yes, as we both know,
Right.
as children. Jamie Friedman, Dr. Friedman, thank you very much for being with us.
Thank you very
We
much.
appreciate it.